Good morning everyone, I'm Rena Venice Laksamana. Today I'll perform a HOT application. This will help to increase blood flow. Verify the patient as his name, birthday, and age and check the ID band. We do this to perform the right intervention. Verify the order for what type of moist heat application, location, duration, and desired temperature. Review client's chart for medical history and contraindication that may prohibit the use of hot or warm therapy. Assess the client's skin around the area to be treated for us to know where to apply the warm compress. Inspect wound, if any, for size, color, tenderness, or odor, for us to know how severe it is. Next is to explain to the patient or assess the patient and the family to understand the procedure. Next is to assess the client's vital signs and mobility for us to know if it's stable or not. Identify expected outcomes for us to be able to be aware what will the outcome will be. Gather all equipments to save time. Next is to explain the procedure clearly and ask for the patient's approval if it is okay for him to do the procedure. Describe the sensation patient would feel so that hindi siya mabibigla sa mararamdaman niya. Next is to perform hand hygiene and wear gloves to prevent the spread of microorganisms. Next is to place a towel under the area you will treat para maging komportable yung patient and hindi po mabasa yung bed niya. Next is to apply heat compress in the affected area. The indication for this, he has muscle spasm and soreness. The benefit for this, it helps promote circulation and encourage healing. It also decreases pain and discomfort. After the prescribed time for the treatment, up to 30 minutes for warm compress, remove the warm compress. Stop immediately if untoward incident or problem occur. Inspect the body part of the wound condition for us to know kung paano po siya ka-effective yung therapy and kung sensitive po ba siya kapag hinahawakan siya. Next is to ask the client to describe the level. In this case po, tinanong ko po siya up to 10 kung paano po siya nag-improve and he said 7. So, there is still an improvement. Then, check again for the vital signs and compare it to the baseline in the first vital signs you take. The contraindication for hot applications are not applicable for person who have fever, malignant tumors, dermatitis, impaired circulation, impaired skin sensation. Then, after checking the vital signs, let's identify any unexpected outcome po. Assess the patient before and after the application. So, based on my assessment po, may improvement naman daw po yung pag-apply ng hot compress, which is medyo nabawasan po yung sakit ng paa niya. And after that po, document and report all the information and the procedure we perform. A warm compress can help us to increase blood flow to sore areas of the body and can help to reduce pain and speed up healing process. Indications may be muscle spasms and soreness, ear infection, boils, menstrual cramps, or edema. Next is applying a cold compress. It's used to cool an injured area, reduce pain, swelling, and inflammation, which can help slow bleeding and minimize bruising. First is to verify the patient para hindi po tayo magkamali sa ibibigay nating intervention. Next is to verify doctor's order. What type of moist cold application, location, and duration. Next is to review client's chart. Assess client's skin around area to be treated. Inspect wound if any, size, color, odor, or tenderness. Assess the client and family awareness sa procedure po para alam nila kung anong mafe-feel and gagawin natin sa kanila. Next, assess the client's vital signs and mobility. I-check po muna natin yung baseline na vital signs, then after the procedure, ulitin po natin siya. Then, identify expected outcomes para alam po natin kung ano yung tinitignan natin or dapat natin ma-achieve. After that, let's assemble and prepare equipments needed po. Then, explain the procedure clearly and ask the client if okay lang po bang gawin natin yung procedure sa kanya. Then, after that, describe po natin kung anong mafe-feel niya kapag nilagay natin siya para hindi siya mabigla sa mafe-feel niya po pag in-apply na natin yung compress. Then, provide privacy at all times. Then, position the patient and expose the area only, yung lalagyan po lang natin ng cold application. Then, perform hand hygiene and apply clean gloves to prevent the spread of microorganisms. Then, place a towel or waterproof pad under the area we will treat para hindi po mabasa yung patient natin. Put some ice in the water so that it's a cold compress. And then, ibabad po natin yung towel natin na cold compress. And then, i-apply na po natin sa affected area ng patient. Ang indication po natin dito, yung patient is may toothache or dental pain. Tutulungan po nito na mabawasan yung pamamaga or It can also help numb dahil nga po malamig yung i-apply natin for temporary pain relief. Remove, remoisten, and reapply for 20 minutes para ma-maintain po natin yung cold temperature as needed. The contraindications for this are in cases of impaired circulation, cold hypersensitivity, open wounds, and certain other conditions. Check skin condition if may improvement po ba or lumala siya, para alam po natin kung anong gagawin nating next procedure. And then, take note po, stop application immediately pag hindi na po comfortable yung patient. Application of cold compress is only for 20 minutes po. Then, after that, check the vital signs again if may improvement po ba or stable pa rin po ba siya or tumaas siya. The indications of cold compress or cold application after direct trauma, muscle spasms, dental pain, after muscle sprains, treatment of a chronic pain. After all the procedure, assess it if it is effective or not effective, and tingnan po natin if may improvement po ba before and after application of cold compress. Then, help the client to a comfortable position para hindi po siya nahihirapan. Then, ask the client to describe the level of comfort and burning sensation. Then, identify an unexpected outcome. Then, finally, remove your gloves and perform hand hygiene and document all the report. Good morning, everyone. I'm Rena, Venice, and I'm from Our Lady of Fatima University. Today, I'll perform a postmortem care. First is to check the chart and check the patient is declared dead. Then, if may kasama po siyang relative, ask the relative if she want to stay or to go out while performing the postmortem care. Next is to perform hand hygiene and put on gloves. And then don't forget to perform or provide privacy for the patient. And then remove all the sheets, blankets, and the gown from the patient. Remove any tubes or IVs, Foley catheter, and heart monitor if meron po. And if you can do it, ask for assistance to another nurse. And then if she have dentures or glasses, put it on the container and put it on the side of the patient's bed. They should be placed later on the body bag with the patient. And then next is to perform a bed bath. Give the bed bath like you would do if the patient was still alive. And don't forget to still provide privacy. Some facilities require to put you a fresh hospital gown. It depends on the policy of your supervisor. If unsure, double check it what is preferred to do. After doing the bed pad, you should now tie one of the name tags onto the patient's big toe. You should now unfold the body bag. Then roll up half of the bag long ways. Then turn the patient on the other side. And then we should now tuck the old linens underneath the patient and place the clean fitted sheet on the mattress. Tuck the fitted sheet under the patient as far as possible. Now, tuck the rolled end of the bag underneath the patient. Then after that, turn the patient into another side and then finish putting the clean fitted sheet and unroll the rest of the bag. Then you should now be able to zip up the bag. Don't forget to tie the two zippers together with another name tag. Then after that, stretch the flat sheet over the bed, completely covering the body bag for respect for the patient when you get out the patient to the room. Then don't forget to put the dentures inside the body bag of the patient. And then make sure the belongings get to the patient's family with the name tag or with another name tag on it. And then after that, remove your gloves and perform hand hygiene.